Welcome back to Medically Speaking. Hip dysplasia is the most commonly diagnosed orthopedic condition in dogs, and it affects up to 15% of all dogs, sometimes up to 70 to 90% depending on the breed. Dr. Pfeffer is here to join us. He's with Eastern Carolina Veterinary Medical Center. Dr. Pfeffer, let's start with, what is hip dysplasia?
Yeah, so at its core, hip dysplasia is simply a failure of the hip joint to develop properly, okay? And this abnormal development leads to excessive and abnormal motion within the joint itself, and that ultimately leads to cartilage damage and degeneration of the joint, as well as the pain that we consider associated with arthritis. And so animals suffering from hip dysplasia will very often exhibit some very classic clinical signs, and that ranges from a narrow-based stance on their back legs and shifting their weight to their front legs, bunny hopping when they're running, difficulty getting up from a lying or seated position, as well as muscle atrophy, simply limping if one hip is more affected than the other, and then difficulty or a reluctance to rear up on their back legs or climb on and off of furniture, which some people may think is a good thing, but it's actually their dog telling them that they're in pain.
Well, there are some breeds that are more likely to get hip dysplasia than others. Are there any treatment options or things that I can do to prevent hip dysplasia?
Yeah, absolutely. There are several procedures available with the goal of improving the conformation of the hip. So conformation being how that hip fits together. And if we are successful, we can limit that abnormal motion and hopefully prevent degeneration of the hip. The downside is these procedures have to be performed in young, actively growing animals before any degeneration starts, and more often than not, people just don't perceive that their animal is really having a problem, or maybe their animal just isn't affected enough to display clinical signs, and we ultimately miss our window.
So what are the treatment options if my dog is actually experiencing symptoms?
Yeah, first and foremost, for the majority of patients that come to us with hip dysplasia, we are going to try a more conservative approach that is based on multimodal medical management, and that more often than not will involve veterinary-specific nonsteroidal anti-inflammatory drugs, joint supplements, prescription veterinary diets with high levels of omega-3 fatty acids, physical therapy aimed at really kind of beefing up and maintaining the muscle mass around those hip joints, and then probably most importantly, maintaining an appropriate body condition as well as weight to try and limit the excessive load that they're putting on their hips, okay? For animals that are either too painful for medical management or fail medical management, or even have x-ray changes that are just too bad to attempt medical management, we are going to recommend a surgical procedure. And those two options are a femoral head and neck excision or a total hip replacement. And both have their merits, both have their potential issues, both have their place in our treatment arsenal.
So what exactly is involved when doing a total hip replacement?
Yeah, very similarly to what would happen in a human. Essentially, it is removal of the native ball and socket joint and replacing those with synthetic components, so a synthetic stem, head, and cup. Replacing a hip is no small undertaking. We employ a team of 3 to 4 veterinary technicians whose sole job is to assist the surgeon during the procedure, and that is in addition to our anesthetic team, who have the primary responsibility of making sure the patient is comfortable and obviously stays asleep for their duration. Everyone has a very specific role, and everyone is working together to try and ensure a successful outcome, and that includes our owners, who arguably have the most important job of anyone, because once their pet leaves our facility, they are the sole caretakers, and they are responsible for making sure that they receive appropriate care and that they follow their discharge instructions, because dogs don't read them.
Well, thank you so much. Your reputation certainly precedes you. Eastern Carolina Veterinary Medical Center, still located on Greenville Avenue in Wilmington. Thanks for joining us. We'll see you next time.